All right, so it is 2:03. This meeting is being recorded. We do have our full board, including a new member who has been seated, and that would be Jeff Fiedler, one of our commissioners. So our board currently consists of Kayla Marcella and Jeff Fiedler as our county commissioners. We have Kimberly Jackson, Steve Boyle, and Cornelia Patty. So thank you all so much for being here. We have a pretty packed agenda, but the first thing that I would like to talk about is starting this new year. It's important now that we have a fully seated 5-member board that we pick a chair and a vice chair. I, as the Director of Public Health, have the ability to serve in the role of secretary and take notes, unless somebody else wants to step up and wants to be secretary. I'd be more than happy to hand that over. So I think the way I'd like to start off is that, is there anyone who is dying to be the chair and or vice chair? So basically the roles of chair is truly just to be the moderator and facilitator, if you will, of the meetings, work our way through the agenda and go from there. Obviously, they're also that point person that if the board feels strongly about something in the public health world, they can, push all of that to the chair, and then that can then come directly to me. Obviously, I will always take feedback from any one of your folks, but that's kind of trying to keep that in a structure of a true board, if you will. With that being said, is there anyone who feels strongly about being the chair and or vice chair? Do we have any nominations? And you can self-nominate. Feel free to unmute yourselves.
Jeff, would you be interested in doing the chair role?
I'm willing to do it. I feel hesitant stepping into a board I have never participated in and assuming chair role. Just not knowing how you guys operate or any of that. But if everyone else is taking a big step backwards, I could take that on, I guess.
I don't think the role of chair is quite as big as like our commissioner board chair. So I think it would be great for you to do it. And I think you do a great job.
Thank you for that confidence. I'm sure I will step forward.
Okay, so I hear that Kayla Marcella has nominated Jeff for chair. Can I get a second?
I second.
Thank you, Steve Boyle. Okay, I'll do a roll call to see if we will see Jeff as the board. So I'm just going to go down on my screen. Cornelia Patty.
Yes.
Okay. Kimberly Jackson.
Aye. Did you hear me?
Yeah. I did, Cornelia. Sorry. Thank you. Steve Boyle.
Okay.
Kayla Marcella.
Aye.
Great. So we have unanimously selected Jeff as the chair of the Lake County Board of Health. Do we have any nominations for a vice chair? And that person just steps in if Jeff is not available at a meeting to run the meeting.
I nominate Kim Jackson for vice chair.
I apologize. I've still got one more year of school. I just can't at this time.
Thank you, Kim. I totally appreciate that. There's no pressure. Would anybody like to be the vice chair? So that would be Cornelia, Steve, or Kayla. Like I said, it's a very informal role. You come behind Jeff if he's not available, and obviously I would assist in any way possible to have that meeting rolling.
I'll
What was that, Steve? Go ahead.
I'll self nominate myself for vice chair.
I'll second that.
Great. Going to do roll call on that. So Commissioner Fiedler,
Aye, yes.
okay. Cornelia Patty,
Yes.
Kimberly Jackson,
Aye.
and Kayla.
Aye.
Great. And so we now officially have a chair and vice chair. Thank you guys so much. I absolutely appreciate that. Okay, so the next piece of business is the Health and Happiness Project. I did send the board all of the information of what we've been doing this year in conjunction with Lake County Build a Generation, as well as St. Vincent Hospital, to do what we call our community health assessment, specifically in public health. We have finished that process and we're going to be moving on to our implementation plan. And so I do have Katie Baldazar, the executive director of Build a Generation, on, and I will defer to her and allow some screen sharing so that she can share her slides.
Oh, I think you've disabled participant screen
How about
sharing.
now?
Ah, there we go. Okay.
Okay, great. Thank you.
Okay. Hi, everybody. My name, I think I know all of you here, but just in case, my name is Katie Baldazar. I'm the executive director at Lake County Build a Generation. And like Colleen said, our agency partnered with the with St. Vincent Health and the Lake County Public Health Department to conduct this Health and Happiness Project. Colleen, is the Board of Health planning to adopt this today? Is that, or am I misunderstanding that?
I hadn't put that on the agenda for adoption. It was more of that introduction, and
Perfect.
then we can work to adopt that if there are any questions at another meeting.
Okay, sounds good. So ignore that last bullet point. We will only be presenting and asking questions today, and then you'll have some time to think about it, I guess. So I'm just gonna kind of run through, you guys have a copy of the plan to read. Some of you I know participated in it. But give you kind of a brief overview. So why a health and happiness plan and why now? So some of this is just regulation. So the IRS requires that nonprofit hospital facilities identify and prioritize the significant health needs of a community every 3 years. And then the Colorado Department of Public Health and the Environment requires local public health departments to do a similar process every 5 years. And since 2012, our community has been coming together and sort of slowly saying like, well, we should at least be aware of each other's planning processes, and like, well, maybe our plans should align in some way. And now we're really at the stage of like, we should just do one plan. And that is really what we did this year. So public health has always had to do a public health improvement plan. Hospital has to do a community health needs assessment, and Build a Generation always has had to do what's called a risk assessment. They're all fairly similar. And so we just said, hey, let's do this together. And just as a sign, you know, I think we sort of take for granted this kind of collaboration in our community, but I actually got a call this morning from a public relations firm in Washington, DC, and they had heard of the work that we're doing on the Health and Happiness Project and wanted to invite our community to present at a webinar that they're doing, a kind of nationwide webinar, and share what we're doing in Lake County. So I always think that's exciting to that people across the nation are looking to us and saying, hey, tell us a little bit more about, you know, how you're doing things there. So the process, as you know, because of COVID, we couldn't do the kinds of meetings that we would traditionally do. And so we had to go to a really different format this year. We, for the first time, did a survey for this process. About a little over 5% of the total county population took the survey. So that's a pretty good sample size. We wanted to make sure that not only did we get about 5%, but that it was a 5% that reflected the community. And so we engaged 7 community members that had strong community ties to help us reach youth, seniors, and Spanish-speaking residents. And we were really excited that the final survey, the sample of people who took the survey, for the most part, really represented community demographics. The only exception is males. We just could not get men to take the survey. So next time we will know better. And we used a survey that was developed by the city of Santa Monica and they called it their community well-being survey. But I think that was part of why we got such good engagement, that it was a little bit more of a fun survey to take than just a survey that was about health behaviors only. We then held 3 community meetings. A number of you attended those to kind of review and prioritize the health needs in our community. And then going forward, we're going to see a steering committee of key partners and key community leaders to regularly review the work on the 3 outcomes, which we'll talk about what those are, to hold ourselves accountable and say, okay, our community said, these are the 3 issues. We need to make some headway on them. Are we really having an impact? Are we really moving the needle on those things? So 3 issues, housing, no surprise really. Housing, people said, we have to have affordable, safe, accessible housing for everyone in our community. Childcare, as you all know, there's no licensed childcare right now in Lake County for 0 to 3 population, and not enough slots for 4 and 5-year-olds. So that came up as a really big issue. And then livable wage. And folks identified that this was really related to housing and childcare, that it was all connected and really all about economics, family economics and community economics. So definitely we've gotten the question of, housing, wages, and childcare are health priorities. And yes, they are. These are what are called social determinants of health. If you look at the chart I have here, about 20% of our health is related to our access to health care. About 30% of our health is our health behaviors. What do we eat? How often do we exercise? Do we choose to use tobacco, et cetera? And about 50% of our health is really what we call social determinants. It's about where we live. And the community that we exist in and our relationship to things like transportation, housing, education, food, and income. And those factors over our life have this huge impact on our health, such that, you can take, for example, census data, and by zip code, you can look at life expectancy and how much it differs in poorer neighborhoods and richer neighborhoods. And then, what's going to happen next? We already have in our community a robust housing coalition. We'll continue to facilitate that, hoping that St. Vincent Health and your Build a Generation will continue to facilitate that with St. Vincent Health and Public Health Department continue to support this. This is a place that the county is also really involved in, and we appreciate childcare. I know Kayla has been really involved in this, but just yesterday there was a strategic planning session, the first of 2 strategic planning sessions. That strategic plan, I think, will be finished within about the next month, and then taken up by the Communities That Care Coalition, which is going to, really try to bring stakeholders together and figure out what we can do to develop a sustainable, affordable, quality childcare system in Lake County. Livable wage, that's a harder one. Unlike the other two, it's a problem we can't just solve in our community, because 70% of our workforce doesn't even work in our community. And so we'll be working over the next year to just figure out what is the best way for our community to have an impact on ensuring that all of our residents have access to a livable wage. We'll also, this is just a picture of the policy advocacy team, which is working on housing policy. We'll also be, as I said, bringing folks together regularly, probably twice a year over the next 3 years to check in on and then report out to all of you on, are we really making progress on these 3 issues? And, starting to look ahead to, because we'll do this planning process again in 3 years. In order to stay in compliance with CDPHE and the IRS. So that was kind of a quick run through on the Health and Happiness Project, and happy to answer any questions that you all might have. And I'm sure Colleen is as well. She was deeply engaged on this project.
Hi, Katie. Thank you so much for your presentation. I appreciate it. I have a question. Would you be willing to share this information at the next Housing Coalition meeting?
Oh yeah, sure. Yeah.
Wonderful. Okay, I'll shoot you an email.
Okay, I will talk to Christy. Yeah, you shoot me an email and I'll give Christy a heads up that you asked.
Awesome, thank you. Oh, sorry, did I say Housing Coalition? I meant Housing Authority.
Oh, Housing Authority, yes, okay.
Sorry.
Yes, I would be happy to come and talk to the Housing Authority. And yes, if you can give me the information about when to show up and that sort of thing.
Thanks, I will do that.
And I think just to that point alone, right, Kim, the fact that we have a housing coalition and we're working, housing authority. And I think the other piece to note prior, if there's any other question, is the fact that while these 3 things have been identified, it doesn't change some of the work that we currently are continuing since our last health assessment. We still know that there are issues like access to care and some other pieces, environmental issues, that they just don't go by the wayside. This just becomes part of, the work that we're doing in conjunction with our partners. So I thought that was an important point to make. It's not like, yep, everything we decided 3 years ago just drop. It's just, how do we build on that? What can we do? And very excited about those results and really recognizing, per Katie's presentation, those social determinants of health is what really is helps drive and move. If we can focus on those pieces and make a difference, that really helps drive other more positive health outcomes. So thank you, Katie, so much. Any other questions for Katie?
I was just going to ask, is there anything you need from us? Or is this sort of like a FYI?
So no, I think that's a great question. I would like the Board of Health to formally adopt it. I do not have that on the agenda. I don't know that we can add it. I would have to rely on a commissioner to say, no, we can add it and we can vote on it now, or does it have to come out on a separate agenda? So if somebody has that answer, feel free, or if we feel confident to adopt that. So basically, just so you know, Jeff, is that this is truly like the framework that we turn into the state, like specifically Colorado Department of Public Health and Environment, to show that, yes, we have, reached out to our community and this is what they're asking for. And these are the ways that we are gonna, move that forward. So it is a very important part of public health. And the board, has to recognize that that work is done, under the public health umbrella in conjunction with our other partners.
Thanks. Colleen, I would prefer for us to put this on a separate agenda just for transparency purposes.
Yeah, absolutely. Like I said, I continue to learn how to do these meetings better. So yes, we will put it on another agenda. Thank you so much, Kayla. Thank you, Katie, so much for being here. Appreciate your time.
No problem. And Jeff, I was just going to say too that St. Vincent Health adopted it last week, and calling in the Village Generation Board and hopefully the City of Leadville will also entertain adoption. And so the idea is really just alignment. These are three big problems no one agency can solve by themselves. So sort of collective community, what we're seeking probably from you more than anything, adoption is a sign of this, but is that collective community commitment to saying, yes, as a community, we are going to work on these three issues. Okay. Thank you all.
Yes, thank you so much, Katie.
No problem.
And so the last piece is for me specifically is just a COVID update. As you know collectively, we have been pushing out information on our situational awareness calls. We had seen a spike in cases with a suspected outbreak. We are working through that. We feel confident that that suspected outbreak is kind of decreasing at this point in time, and that's reflected in our cases as well. We also have on our meeting, Dr. Lisa Zerlinger, who's also our medical advisor for Lake County Public Health Agency. And Lisa, is there anything you would like to share about COVID-19? Other than we know that we have vaccinations for 65 and up at this point in time. Public Health is working with Lake County School District to do a point of dispensing. That is what we call a closed pod. So pod being a point of dispensing. So specifically for that group tomorrow. And that's basically what I want to share. Lisa, did you have anything? I said, can't tell if you're trying to unmute, Lisa, or if you're good. Thumbs up if you're good. Her volume may not be up loud enough to hear us. So if she decides to jump in, that's
I'm
great.
sorry.
Oh, you're
I'm trying to do three things at once. I'm not so good at that.
And so
No,
go ahead.
yeah, I really don't have anything else to add. You know, obviously we're all exhausted trying to get shots in arms as best we can. We have more cases, you know, over the past several days than I've seen yet. My volume here at the office is crazy. We're seeing over 100 patients a day. So yeah, it's not good. I wish it was better, but it's not.
People, do they need to be asked and everything?
And I think the take home there, Lisa, is we do recognize that people are fatigued. And so we encourage them to continue to commit to those containment pieces, wearing a face covering, remaining 6 feet apart from folks, not mixing with other households, staying away from folks when you're sick, washing your hands frequently are our big five. So
yes, ma'am. Wish us well. We're in the trenches. We'll get through this though.
Yeah, wildly here. I don't even. Yeah. Now if they go through a regular doctor.
well,
Colleen,
thank you, Lisa.
I know that he's.
Colleen, can you explain more about that pod dispensing? Is that going to be an additional location where people can go to get vaccine? Okay.
No, so it's a closed pod, which means that it's invite only. And so that invite is only for our Lake County School District. And so we've been working directly with Bethany Massey and Bunny Taylor to ensure that their staff has been notified and has made appointments. And so it will be only for that group because as of February 8th, so as of this Monday, the state did open it up to 65 and up, as well as educators. And so we have both St. Vincent Health and Rocky Mountain Family Practice focusing on the 65 and up, while we work our way through educators, specifically kindergarten through 12th is what's coming down from the state at this point in time. So, right, it's not, when we get numbers of vaccine where we have like 500 vaccine coming in a week, then that would be a great way to open up what we say an open point of dispensing, where probably we would do kind of that drive-through model that we had practiced in November with our flu, which we had talked about before.
Thanks for clarifying.
Absolutely. Great question. All right. That is the end of my part. And so I would like to turn it over. Just going to show you is now the public hearing. So I'm going to turn this over to Jackie Littlepage.
Hi, everybody. Thank you for joining us today. The public hearing will be in regards to a variance request for Cannon, Cynthia, and David, a joint share property, a variance to obtain a OWTS permit for it's going to be listed as limited occupancy because it's a property that will not have a well or running water. They want it to be used for year-round commercial use hut. And the septic system will be a dry composting toilet, which to my knowledge, this will be the first one permitted in Lake County, and a small on-site wastewater treatment system for the remaining liquid waste. So I do have some documents that I could share screen if I've got that ability.
Jackie, you should, and I think it's important when we're ready for the public comment that we recognize everyone who's on this call. So I am just gonna take my notes here because I have to document that. And so it looks like I have two that I don't know of. There is one iPad, which I know is Cornelia Patty. There is another iPad. Is that you, Cornelia, as well, or is that someone else? If you're able to unmute, that would be helpful.
I think it's just me. you know.
Okay. Yeah, okay. And then the other one that we need to identify, and you guys might know this because I know it's a local number, is 719-486-4134.
That's Patty Berger, Colleen.
Awesome, thank you. I just want to make sure I capture everyone on this meeting. All right, thank you so much. And Jackie, if you'd like to proceed.
Sure. Let me see if I can. I can't share screen until you stop sharing. All right. Let's see here. Sorry, it is not here. You all see this? Yes. So I'm trying to share Lake County parcel viewer of where this parcel will be located. You might notice off to the left-hand side, we've got the Homestake Trout Club area. Sylvan Lakes is kind of to the north of that along Highway 24. This particular parcel is going to be in the center of the screen, hopefully located with the Lake County parcel information here highlighted. This is a 10.28 acre parcel. The adjacent property is another same owner, Cannon Shockley. And then there is a 10th Mountain Hut division. And then the remaining parcels are Forest Service. So it is considered kind of backcountry, off the beaten trail. So this one would be what we would consider an ideal location for these limited occupancy variances. What they're proposing is a use of, see if I can switch views. Did it switch views for you? Are you all now seeing the septic design? No, not yet, Jackie. Not yet. Okay, let me try again. Here we go. So the hut will tie into a tank, 500-gallon holding tank for the liquid waste that will then flow into a small OWTS soil treatment area that will consist of 10 infiltrators, 2 rows of 5. So this septic system is sized appropriately for the proposed seasonal summer and winter, but limited. They've proposed up to 10 people sleeping in the facility at any given time. Because there is no well and no running water, this limited use variance would be required. The water that would be collected into this system would consist of either snow melt or what's hauled in during the summertime from the users. I'm going to swap screens one more time for you here. And is it now showing the model M12 specification sheet?
Yes.
Okay, good. So this is a spec sheet for the proposed, oh my goodness, what is it called again? Composting toilet holding tank. The manufacturer did leave a note that it does need to remain at 65 degrees Fahrenheit. So there is a proposal for, if necessary, a heating device to keep the hut at least 65 degrees Fahrenheit to heat this composting process to keep it working even during the winter time. It's proposed is waterless, but there will be some liquid waste drainage that then will go into that proposed OWTS that I just showed you. The plans that had come through to me have now met the minimum requirements for Reg 43 OWTS requirements, and therefore I've brought it to Lake County Board of Health to decide if you feel that it is appropriate for this kind of a limited occupancy septic system and composting toilet to be used at this hut facility that is considered in the backcountry area for, again, limited occupancy with no running water. My professional opinion of this would be to approve such use. I think that this is a good use, and so far, like I said, the plan meets the minimum requirements of State Reg OWTS 43, and I would entertain any questions or comments at this time.
Hey, Jackie, this is Kayla. I just have a quick question about if the design meets the minimum requirements of the reg, what is the cause of the variance?
That this site does not have any running water. So in order for a building permit or septic system permit, they have to have running water. If they don't have running water, then it would be a variance to allow for what is it, habitants of a structure, and to show the minimum requirements for the waste being retained and disposed of properly.
Okay. Thank you.
Can I ask a question? Sorry for my sort of lack of experience with sort of these kinds of approvals of the variances. So seems like this kind of setup is one of the things that might get covered in the future under any potential backcountry zoning, you know, that's under discussion. I'm just curious, does this set any precedent for that we're in any way bound by? Or is this, because that's not in place yet, this is we're operating under current rules, and if we change that or adopt a backcountry zoning, that'll be covering anything going forward from there?
Correct. So this is the current process, the variance process for allowing such limited use occupancy structures. I believe later on the agenda, under Paul Clarkson's time, we're going to entertain a quick discussion on the future possibilities of changes for backcountry regulations.
Yeah.
But this particular site, this particular OWTS and composting toilet are under the current regulations, the current processes for obtaining a variance.
Okay, great.
For clarification, Commissioner Fiedler, I'd like to tell you that this comes under the heading of a conditional use permit. permit that Canon obtained from the county a couple of years ago. So it's kind of a unique circumstance with regard to the backcountry zone.
Yeah, and the
Gotcha,
Lake
thanks.
County Board of Health is directly involved in the OWTS, or on-site wastewater treatment system, regulation, development, and approval process. So OWTS regs get voted on and adopted by the Lake County Board of Health. So welcome aboard, Jeff.
Thank you. Taking notes.
I have a question. Do we have other examples of 10 mountain huts that are using a similar system, or is this unique to this property?
So this one is unique to Lake County so far. However, the proposal, the design that was submitted, and I sent you all of the design documents and all the information in a separate email. So you can certainly refer back to that if necessary. But the plan is based off designs for huts that are also being used in Eagle County and some of the other surrounding counties. The composting toilet is just new to Lake County because, to my knowledge, we haven't had any others proposed or used. And then the limited occupancy for not having a well. This is the first property that that I have been involved in doing the limited occupancy variance to not have any running water of any sort.
I guess my question, and an additional question, is that limited occupancy, because 10 people on it just seems like, that seems like a lot to me.
Thank you for bringing that up. This is a very good point that I do need to jump in and correct. So typically limited occupancy is currently listed in the OWTS regulation as limited to 90 consecutive days or 180 days per year. And so you're right. Thank you so much for not letting me forget this, that this proposal is asking for that specific statement to be amended so that this facility can operate year round with up to 10 people per day with no further limits. So the limited occupancy, they are asking for a variance from the limited occupancy, I guess is what we're saying.
So what would the limited occupancy be as it is?
So currently our regulation states limited occupancy is 90 consecutive days or 180 days per year. This variance is asking to waive the limited occupancy, which they would be required to have in order to have a facility without running water. So yeah. I'm sorry, this one is unique in that they want to have a year-round accessible facility to be inhabited for up to 10 people without running water. So that's the uniqueness of this one.
Okay, so if I'm understanding this correctly, if we don't approve it, they're limited to that standard of limited occupancy. And if we were to approve it, then we're allowing them to have 10 people every day of the year. Do we have examples in Summit or other places that have allowed that variance?
I do not have that information as far as which counties have approved any variances like that. I only have that these systems are actively being used in Eagle County and the other counties where 10th Mountain Division huts specifically are used. I do see that Ben Dodge is on this call and he's raised his hand. So if we all are okay, I would like to open it up and allow Ben to see if he can maybe answer that question for us.
Yeah, thank you, Jackie. I really appreciate this. And Kimberly, good questions here. The use of compost and toilets is permitted at our backcountry huts in Gunnison County, in Eagle County, in Summit County, and Grand County. The size of those huts, it's also important to note, the huts in Summit County, which are permitted with compost and toilets, have a capacity of 20 people year round. The hut up in Grand County, the Broom Hut, located on Berthoud Pass, is permitted year round and capacity of 16 people. And then there's another couple of smaller huts as well, which are permitted again with composting toilets. So the capacity is proven. It seems like it works quite well, as a matter of fact. But I'm happy to answer any questions, because I think it's really important for the board to have a good understanding of what this is and feel comfortable with the approval.
Yeah, I appreciate that. I just want to, that's good information to have, because I just want to make sure we're not overloading the system.
Mm-hmm.
Jackie, would I be correct in assuming, assuming then that the statement of motion for this variance needs to be twofold? One, for the septic system itself because of the lack of running water, and two, the limited use occupancy?
Yes, it would be. And I'm sorry, I was looking back at the agenda and that I had striked through that they were no longer proposing just a winter use, and that it had gone, I'm sorry, the application had been amended in January to open it up for year-round use. And I did not put on there to waive the limited occupancy due to the lack of running water. It just listed that it will not have running water. So correct, we would need for this one to entertain a vote to allow a variance to be accepted, to allow a composting toilet and small OWTS on a property without running water, and to waive a limited occupancy limit of days and allow them the year-round use.
But I might mention, Kayla, that I think you could probably do that in one motion if all of you like. There's no reason to split it into two motions, but it's a very good point both Kim and Kayla make. Yes. Jackie, can I ask Cannon a question?
Sure.
Cannon, you're planning to heat the whole building to 65 degrees throughout the winter?
No, just the room with the composting toilet will be heated to 65 degrees. That kind of goes along with what some of the other huts in Summit County and whatnot, they heat a insulated space just where the composter is to 65 degrees to keep that moving along.
That does make more sense. And how do you heat it?
It will probably be, I submitted to Jackie it's a small no vent propane heater, which I also got the specs from the Summit huts for the same one they use. It's going to be the same size. The toilet is the exact same one, the M12 that they use, and they use it for a larger hut. Mine's 10, theirs is 14, but I'm using the same heater that they use up there.
And propane capacity is not an issue?
No, it'll just have to be hauled in. It actually doesn't use that much propane.
So you probably have enough then to last the winter?
Yes. Yep, for sure.
Hi, Ben. Twice in almost as many days. That's something new, huh?
Yes, indeed.
Cannon and Ben, you might want to hang around for the next item. I'd be interested in your comments on that.
Jackie, I don't have any further questions, and I apologize, Jeff, if I'm overstepping or stepping on your feet here. But I think at this point, I feel like we might be comfortable to open it up for any public comment and open that public hearing piece.
Thank you very much, Kayla. Yes. Are there any additional public comments?
Not hearing any. Maybe just if anyone's having trouble with their mic, type it into the chat quickly and we'll move on.
Jackie, you didn't receive any public comments submitted to you through email or mail, yes? No?
Correct, I have not.
Okay.
So I'm not seeing anything in the chat. So I think we're ready to go ahead, and maybe people can help me and make sure. I think that if I heard it right, there's a suggestion for sort of 2 separate motions to break this in. Do we feel that's, I mean, maybe it's just easier. I think it'll be quick. But if I understood it, one is for the variance and one is for the permit itself.
Commissioner Fiedler, I don't think it's necessary to do 2 separate motions. You can combine them all into one.
I can take a stab at that if you'd like, Commissioner Fiedler.
Can you do that in 1 second? I just wanted to quickly poll the other board members and see if anyone has a problem with us doing it as one motion.
Sure, no problem.
So any other board members uncomfortable with proceeding as one motion? Hearing. Sorry, I think I talked over someone trying to talk there. Okay,
I was just saying thumbs up.
Okay, great. Thank you. Sorry for the Zoom. So hearing no objections, we'll proceed as one motion.
Yep.
Can I get a motion?
Sure. I will make a motion that we, as the Board of Health, approve the variance request for Shockley, Cannon, Cynthia, and David JT to obtain a variance to permit a year-round commercial use hut with the composting toilet on-site wastewater treatment system and waive the limited use requirement.
I'll second that.
Great, thank you, Kim. And just for the record, sorry, Colleen, are you taking notes of who's moving and seconding?
I am, yes. And if you would like to call for the vote as chair,
Yes.
that would be great too.
Excellent. That was next up. So I will go through, and apologies if I do not know everyone. So Steve Boyle.
In favor.
Well, actually, and sorry, maybe I'll just ask, I'm used to school board where we go through individually by name, but are we comfortable just doing sort of a voice vote of yes and no votes? Or do we want to go through name by name?
I think it's best via Zoom that everyone's name get listed.
Great, thank you. Okay, so I'll go ahead. Steve Boyle.
Yes.
Great, thank you. Kim.
Aye.
Kayla.
Aye.
And please excuse me, who's the additional member?
Cornelia Patty.
Cornelia.
Thank you. I apologize.
Aye.
Aye, thank you. And I will vote aye as well. Am I missing anyone? Okay, excellent. So unanimous, that passes.
Thank you all very much for your time on that.
Thank you for the clear presentation. That was great. And thanks for all the questions and comments and discussion. So I think if we're good, we can move on to the discussion item from Paul.
Real briefly, I might have to step off, but we should be good. Thanks.
Same, I have a 3 p.m. engagement that I may need to break off for at 3, but am free until then.
So are we ready for me and Jackie?
I think the floor is yours. Yeah.
Okay, might I be able to share my screen? Oh, wait a minute. Never mind. I'm sharing. I got 3 computer screens going on here and I can never remember which is which. So I won't be able to do this. I think this backcountry zoning that you may or may not be aware of. Is there anybody here who isn't aware of that? Okay. What we're looking to do here in the plan, this is a planning commission initiated idea and thought, and it's been actually discussed, I think, in the planning commission for about 10 years now. And what it is a recognition that we do have quite a bit of backcountry. And the zoning district does identify what that is. And the map that I wanted to show you that I can't because it's on a different computer, shows you where those proposed backcountry zonings actually are. The intent is to pretty much allow somebody to use one of their backcountry mining claims as something less than a dwelling unit. And does that show it? Thank you, Sarah. Yeah, I'm not. Yeah, there you go. All of the turquoise or the light blue are the zone districts, are the areas that we are looking at rezoning from what is either agricultural forestry or recreational. These are largely single family zone districts, but they are attempting to encompass as much of, as many of these outlying mining claims where largely there hasn't been any mining is, and there's probably about, according to the assessor, that he thinks that there is about 600 of these mining claims. The intent is to allow for a cabin, a limited use cabin in most cases, which is 90 days in one go and 180 days throughout the entire year. And I think what's most important, I think, to the Board of Health here is the procedure that you just went through with Canon Shockley's proposal would be similarly done with each of these backcountry zonings, that each of application for something less than a standard on-site wastewater treatment system would be processed through the Environmental Health Department, largely Jackie, and then also brought to you for your consideration in the same manner that you just went through. That's all of it in a nutshell. There are loads of rabbit hole style details that are still being hashed out in work sessions with the Planning Commission. And this isn't guaranteed. This is something that is not absolutely going to happen. It's currently under consideration now. We don't yet have an application to process yet, but it's pretty extensive because it's going to probably mean notification of upwards of 1,000 different property owners. But if you, so Sarah, I wonder if you zoomed in on the, let's say the Kevin Gulch, St. Kevin Gulch area. Yeah, if you could zoom down into that and you'll see all the mining claims, see all those mining claims there are currently not accessible in the wintertime, unless by snowmobile, and usually not even a four-wheeler can do it. And there are people that are building backcountry cabins up there, but they actually have to meet a minimum lot size or a minimum dwelling unit size, and it has to be heated, and it requires a full-blown septic system, which generally requires water, which means they have to drill a well. And this is doing that is all for properties that are probably not going to be accessed for 180 days out of the year. So what we're looking to do is provide relief for those property owners that simply want to have a backcountry a hunting cabin or a ski-in cabin that is not necessarily a full-blown dwelling unit. Does anybody have any questions for me or Jackie about? Oh, and I think the main point that that Jackie and I would like to get across is the procedure that you just went through to provide Canon Shockley with a variance from a full OWTS would be entertained on a case-by-cases by you, the Board of Health. Any questions for me or Jackie about that?
This is Kayla. I don't have a whole lot of time. I got to jump off here to get to another meeting, but I do think that as the Board of Health, we might want to talk about this a little bit further, because I think that we've heard a whole lot about staff capacity in environmental health. And so I'm wondering about what the potential impact of several of these variances will have on staff time for staff to complete. And so I'm wondering if it makes more sense for us to talk about building in regulations that complement backcountry zoning that's being proposed by the Planning Commission with environmental health, so that their staff time isn't spent in the trenches on variance after variance after variance after variance.
Kayla, that's an excellent point. And I think the difficulty is that our intent is to try and keep environmental health and the building and planning department as separate as we can. Number one, it's statutorily required that environmental health offices are no longer part of community development. They are part of public health. I think there's advantages to that that are probably greater than the disadvantages to that. But there are almost all of the jurisdictions in the state have to comply with that.
Right.
Number two, we don't also, Jackie or the CDPHE amends its regulation 43, I think it is every 3 years. What we're not looking to have happen is that a regulation 43 amendment occur that might actually affect the ability to process this zone district.
Mm-hmm.
And it also is there's the possibility that the environmental health department's capabilities will actually increase with time. And
right.
With that, they will be able to have the staff ability to do this.
Okay.
But the main concern that we have here is that we don't want to build environmental health rules into a zone district.
Okay. That makes sense. Yeah, I think I would love to continue the conversation with the Board of Health, though, definitely. So, and I apologize for having to jump off. Thank you for your work on this today, Jackie. I appreciate it. Have a wonderful day.
Thank you very much.
I have to say that that's really a good point that Kayla just brought up. And I think it's not something that staff, the Planning Commission, have even considered. And I think it does require some consideration.
I think so too. I think that, as OWTS regulations can be amended every 3 years, we continue to have our two departments work very closely together, hand in hand, through this backcountry zone process. And keep up our relationship and working together and understanding, what regulations could hinder or assist with the process. And I think we can continue to do that, no problem. And if we find any ways to streamline work processes, we can certainly take those into consideration for future reg revisions. So. And again, the Board of Health, you all get to vote on the OWTS regulation changes. So that's why we're bringing this to you today.
I might also indicate that I don't think we're expecting, would be expecting, if this were to be adopted, I don't think we'd be looking at a large rush of applicants to do this. I think that so far we've probably heard from maybe 20 different backcountry property owners who would like to see this. We haven't heard from anybody in the public yet, and that may change when we actually advertise this. But we haven't heard any negative comment about attempting to do this. It's all been quite positive.
Any other further questions or comments for now? And as I understand, this is just a discussion item, and there'll be more bites at the apple for this, for sure.
Yes.
Absolutely.
Hearing no further question. Oh, I'm not sure. I think, yeah, didn't sound like there's more questions. So I think we can close out this. And I think recognizing we're already over time or advertised time a little bit. It's okay with everyone. We can talk about the next meeting of the Board of Health. I would need some help here. I don't know how often we meet.
Yes, so I think, Jeff, thank you so much. And just before we adjourn, because we are missing 2 members, what I will do is I will send out a poll to see when folks are available. So pre-COVID, we would meet quarterly. And since COVID, there's been more meetings that our Board of Health, thank you so much for your time, for showing up to our meetings. Obviously, we have a weekly situational awareness call that you guys are invited to. And I'm thinking that we probably be looking to do something in the next 2 months to look at the Health and Happiness Project and to have more conversation around the backcountry piece. So I will send out an email to follow up with folks as well as the minutes. And I'll make sure Patty Berger gets those as well. But that is all I've got. If you would like to adjourn.
Okay. Do we vote on adjourning or do we just, okay.
Oh yeah, oh, apparently Paul says yes. Apparently we vote, so yes.
Would
entertain a motion to adjourn.
Would anyone like to move that we adjourn?
Steve Boyle, aye.
I second.
Thank you. So calling the vote, Steve?
Aye.
Great. Oh, I think we lost Kayla and Kim, right? So was it Cornelia? Thank you.
Aye.
Aye, and I'll vote yes as well. So we are adjourned.
Thank you all.
Do you need me,
Great, thank you,
to
guys.
read into the record? So at 3:07 p.m. on my computer, we are adjourned.
That's what I got.
Bye.
Okay, thank you, everyone.
Bye.